In this lecture, I'll be discussing Ethnomedicine from Singer and Baer's 2012 Introducing Medical Anthropology, the second edition of their text. I'm going to start with an overview of ethnomedicine. From there, the authors go into a discussion of traditional healing systems and their efficacy and how that efficacy is measured in the context of biomedical and scientific terms. They then talk about different ways of classifying medical systems in terms of the etiology, origin, and progression of disease, as well as various healers who attempt to confront the disease at different levels within society. The authors then present an evolutionary model of disease and healing systems, and as they argue throughout the entire chapter, and indeed in much of the book as a whole, that all medical systems are in fact ethnomedical. That is, they are all part and parcel of a particular cultural situation within which they develop. As the culture continues to change, so too is the medical system influenced. And we'll talk here specifically about the impacts of pharmaceuticals and biotechnology in the context of biomedicine. So what is ethno? Ethno is a marker. It indicates, it's historically indicated non-Western, and it's historically a marker of indigenous origins of a variety of systems. And one of those systems would be ways to deal with disease. And of course, there's a plurality or multiple ways that indigenous peoples across the world confront illness and name a particular disease and have those practitioners associated with the power to name a particular disease and to root it out. Again, a key part here throughout the text is that all medical systems are part and parcel of social and cultural environment within which they emerge. Lynn Payer, in her 1988 text, Medicine and Culture, maintains that there are multiple biomedicines depending on the country as well as the particular cultural situation. So when we're talking about biomedicine, it would be more accurate from an anthropological perspective to talk about biomedicines. That is, how they are constructed in a particular circumstance or situation rather than as a monolithic entity. And indeed, we'll see this more in our discussions when we're talking about medical pluralism later in this class. As Payer notes, biomedical doctors vary depending on the country. For example, there's a fair amount of divergence between the United States and Germany with the use of antibiotics. In Germany, biomedical doctors are much less likely to prescribe antibiotics as they focus on the natural recuperation as well as healing of the body as a whole. We also see differing perspectives on bodily modification and what is looked at as the ideal body, as we've talked about in the context of previous work in this class. For example, Singer and Baer note that amongst women in France, there's a popularity of breast reductions, whereas in the United States, there is a popularity of breast enlargements. The authors then go into a discussion of traditional approaches to healing, and they look at some various aspects of traditional systems. And these are documented in the work of a variety of ethnobotanists, which include not only anthropologists looking at the cultural situation, but also botanists. And Ivan Ross's book here is an example of this, looks at the chemical constituents, traditional and modern medical uses of medicinal plants in the world. And that link there, that URL is actually active to the entire text if you'd like to go ahead and take a look at that. Singer and Baer maintain that traditional systems are marked by magico-religious rituals that are designed to maintain harmony. And they're designed to maintain harmony between a variety of different actors. And so this, there's an idea here that agency corresponds not only to humans and the human interactions with one another, but also between humans in the natural world as well as humans and the supernatural world. And the purpose of these rituals is essentially to maintain the harmony between each of these varying worlds. And again, this depends on the particular cultural context, which of these would be emphasized. Singer and Baer note that members of the community are incorporated into many of these magical religious rituals. And as a whole, they serve as a therapeutic management group. They also note that the estimated efficacy of the traditional pharmaceuticals that are, or the pharmacopoeia as they refer to it, is between 25 and 50%, depending on the given area, that have been shown to be effective in biomedical biomedical standards and in scientific studies. They also note that there is something to the idea of perhaps the potential exoticness of a particular type of treatment, noting that in some cultural situations you see cross-cultural healing being viewed as more efficacious, that is more effective than healing methods that would be present within a particular group or community. And indeed, they note the parallel here with what's going on in the United States with the increase in complementary and alternative medicine, and of course the attempts to integrate that into a larger biomedical system, and the fact that it would be complementary to biomedicine. The authors of the text then essentially conduct a literature review of various anthropologists in their works who have attempted to classify healing systems into particular typologies. And what is the particular point of departure? And each one of these theorists has a slightly different point of departure in terms of what they're looking at and how they're essentially dividing up the world. Pamela Erickson, who you see pictured here at the University of Connecticut, often a co-author with Meryl Singer, one of the co-authors of the book, notes ethnomedical theories of disease causation, and notes that there are three different ethnomedical theories of disease causation. The first of these would be biomedical understandings, derivative of allopathic medicine. The second would be a loss of an internal balance of bodily systems, humoral systems, yin-yang, gender, these sorts of internal balances. And the third would be external to the actor, caused by someone with an evil eye, so an external causative agent. Foster and Anderson in 1978 maintained that every medical system embraces both a disease theory system as well as a healthcare system. They divide the disease theory system into two types, a personalistic and a naturalistic. In the personalistic type, there's some sort of agency which is present, be it human, non-human, or supernatural being as the causative agent of disease. Whereas in the naturalistic system, there's an imbalance of certain elements in the body as a whole. Again, this would closely mirror Erickson's work on a loss of internal balance of body systems above. They also maintain that the medical systems embrace a healthcare system, which examines or is essentially the relationship and interactions between healers as well as patients in a variety of settings. And all of this, of course, is mediated by cultural understandings. Wastananu and Sobo in 1997 look at practitioners specifically, noting the difference between personalistic practitioners, such as shamans, mediums, sorcerers, and priests, and naturalistic practitioners, such as herbalists, chemists, body workers, and lay midwives. Continuing on in various typologies of healing systems, Young in 1976 examines the way in which medical systems organize knowledge about diseases, breaking this down into two types. Internalizing systems, where physiologic explanations are given as well as biophysical signs, and externalizing systems where events are occurring outside of the sick body, essentially leading to this cause of disease. Young in 1976 and 1977 examines knowledge transfer, and this is one of the key interests of Young's work overall, and notes that there are two main types of knowledge transfer: the accumulating medical system, where you see formalized teaching in written forms as well as institutions, so Ayurvedic conferences, massage therapy conferences, professional associations, organizations, medical schools. All of these would be examples of accumulating medical systems, practices in accumulating medical systems. On the other hand, Young points out that there are diffusing medical systems where information is much more guarded It's not shared between practitioners, and sometimes it's even regarded as a secret that only the shaman can possess, and potentially dangerous to others who are outside of the knowledge to be able to control the knowledge, the corpus of knowledge of shamanic practices as a whole. Fabrega in 1997 maintains a biocultural or medical ecological perspective wherein he essentially hypothesized that is a biological adaptation for sickness and healing. That is, that healers in foraging societies possessed elaborate knowledge of social organization, and they were able to essentially rally and help to organize groups as a whole. The authors then discuss on page 126, they have a table where they relate the type of society to causes of illness and types of healers. And I'm just going to talk about a couple of these. More information is available on pages 125 to about 129 in the text. And they look at nomadic foraging societies and early empires and civilizations, as well as industrial societies, chiefdoms, post-industrial societies. Again, I'm just going to highlight the nomadic foraging societies and the early empires and civilizations. In nomadic foraging societies, the purported causes of illness are the self, ancestors, gods, and outsiders. Meanwhile, the types of healers are shamans and diviners. Shamans have engaged with idiosyncratic techniques that is very individualistic. Again, this information is relatively guarded amongst individuals, and we see this amongst the Inuit and Australian Aborigines. The shaman essentially goes to visit the supernatural realm in order to petition for favors. In early empires and civilizations, the purported causes of illness are individual behaviors, moral feelings, elaborate ethnopathologies, imbalances in body humors, and we'll discuss body humors more in the context of the readings for this week as well. The types of healers are priests, professional physicians, folk, and religious healers. As the authors of the textbook maintain, biomedicine is a form of ethnomedicine. They begin with a discussion in this section of Michel Foucault's work in 1975, who notes that in 1800, biomedicine emerges in Europe with focus more on the body than on the ill person, or what Foucault refers to as the clinical gaze. This is what Singer and Baer refer to as the social constructivist perspective. Friedson in 1970 looks at the position of biomedicine in modern societies, the state religions, and pre-industrial civilizations. Essentially, elites control this in both settings, hence professional dominance is delegated rather than absolute. This is not universal with increase in patient rights. Part of this is seeing hospitalization as a sacrifice where one is outside of one's normal self, something that one must endure. Medical negligence and reporting on medical negligence, and increased interest in complementary and alternative medicine. And none of those three things are necessarily distinct from one another. That is, they would all potentially impact and fuel one another. The also notes that the status varies amongst biomedical physicians, and particularly they point out in Mexico, biomedical physicians experience or have less prestige than many other professions. And they also note that there's an increased interest in ethnographies located in hospital settings due to the relative dearth of that previously. They conclude with a discussion of different aspects of biomedicine, particularly pharmaceuticals and biotechnology. Etkin in 1998 looks at the efficacy of pharmaceuticals depending on the cultural understandings of what efficacy means, noting that cultural construction of pharmaceuticals as modern or Western sometimes acquire culturally constructed, fetishized qualities in the sense that possessing a lucky charm, in the same sense that possessing a lucky charm will bring personal fortune. Locke and Nguyen in 2010 describe biomedicine as a technology. Biomedicine essentially is technology-intensive procedures that critical medical anthropologists know produce uneven results for the rich and poor and challenge ethical standards of practice. And we saw this in our earlier discussion regarding the idea of living cadavers in Bangladesh and the organ trade. So in this lecture on ethnomedicine, I hope to have provided you an overview of ethnomedicine, an examination of traditional healing systems, some of the typologies of medical systems that medical anthropologists have employed, evolutionary models of disease and healing systems, and biomedicine and all medical systems as ethnomedicine.